Good morning, everyone. Thanks so much for attending the session, and thank you for your time. So this is some joint work that I'll be presenting, joint work with some co-authors from the University of Cape Town as well, Professor Haroon Borat and my colleague Benjamin Stanwix. I see Haroon is in the audience, so for any difficult questions, I might just redirect them to you, Haroon. The usual. All right, so 15 minutes, great, Rachel, thanks. Right, so a brief introduction. So I think most, if not all of us in the room know that cash transfers serve as a key component of social protection systems globally, and their primary goal typically is poverty alleviation, but there's a very extensive empirical evidence base now that has grown to exist, which shows that they typically have positive effects on a broad range of welfare outcomes, right, including educational attainment, school attendance, of course, health outcomes, etc. But despite this, there is this persistent concern amongst policymakers and various members of the public that these types of programs may discourage work or labor market participation, right? So the standard neoclassical theoretical model of labor supply does predict negative effects, right? But as is often the case, the standard theoretical model doesn't account for various labor market frictions or imperfections that often characterize labor markets globally. Most, if not all, labor markets globally, right? We seldom, if not ever, have a perfectly competitive labor market. There are many types of market failures that are relevant here. So turning from the theoretical model, which again predicts a negative effect, given the presence of these market failures in reality, what do we see empirically? Turning to the empirical evidence, we very seldom see those negative predictions of the theoretical model. And instead, we often see zero, or if anything, usually small and positive effects on labor supply. Right? So various authors in the literature argue that this ambiguity or disconnect between theory and the empirical evidence arguably depends then, or is explained by two broad factors. The first is the actual design of the program, right, with respect to the frequency of payment, whether it's a lump sum or a recurring payment, of course the size of the transfer, targeting, etc. The second broad factor is the underlying economy or the broad economic conditions under which the program is implemented in, right? So in this paper, we consider the case where these two broad factors are explicitly characterized by extreme unemployment. Unemployment, as with others, is another type of market failure, also not accounted for in the standard theoretical model, and a large amount of involuntary unemployment has ambiguous implications for predicting the effects of these programs on labor supply. For instance, one might expect a reduction in labor supply if these programs are thought to increase a recipient's reservation wage, right? Leading them to perhaps be discouraged into participating in the labor market. Or on the other hand, alternatively, these programs might increase labor supply by addressing various frictions in the labor market or liquidity or insurance constraints which might exist in a particular setting which limits an individual's ability to participate in the labor market, right? So you can think of these very broadly as, job search costs, transport costs, data costs, childcare constraints, you name it. So what we specifically do is we estimate the labor market effects of a new, I suppose now 5 years later, not so new, but let's say relatively new, unconditional cash transfer introduced in South Africa, one of the countries in the world with the highest rates, one of the highest rates of unemployment in the world, sitting at about 32% by the narrow definition currently, and hasn't gone below 20% in the last 20 or so years. We estimate the effects of this new cash transfer that was introduced in response to the pandemic, called the Social Relief of Distress Grant, or SRD grant for short. This transfer was initially temporary, only in place for about 6 months, introduced in 2020, but it remains in place today following various extensions and changes in eligibility. And of course, as you might expect, given what I discussed earlier, it remains hotly hotly contested and debated within various circles in South Africa, with many arguing that it might ultimately increase unemployment and others arguing the opposite. So through doing this work, we seek to make several contributions to the existing literature. It largely builds on an existing study which myself and Haroon published earlier this year, which examined the effects of receipt of this transfer during the transfer's first or primary phase. So that was during its first year, in the context of the pandemic and prior to its expansion in eligibility criteria, which I'll speak about briefly shortly. So in this paper, in a follow-up work, we examine the effects of both receipt as well as loss of the transfer, conditional on having received it before. We examine or estimate effects both directly, that is, on recipients themselves, as well as indirectly within the household, right? So spillover effects on co-resident, non-recipient household members. We explore various sources of heterogeneity, namely by employment type, thinking about wage or self-employment, for instance, the formality of employment that one might enter into, as well as by gender, which I think is an important source of variation, which I'll discuss later. And of course, in this paper, we're primarily considering the non-pandemic period. So by comparing our results through a comparable model specification to that of our earlier work, we're able to discern how differences in effects might be attributed to crisis versus non-crisis periods, right? And basically speak to, well, how generalizable were those prior effects that we found before? So a brief overview of the policy. So for those who are unaware, South Africa, as an upper middle income country, has a relatively comprehensive social assistance system and spends a relatively large amount, about 4% of GDP, on social assistance every year. About 90% of expenditure is on cash transfers, most of which in the country are unconditional and means tested in nature. Prior to the pandemic and the introduction of this transfer, there was a notable hole in the social safety net. That is, there was no state-provided support for able-bodied, working-aged, unemployed people. This is somewhat of a concern because given the country's persistent structural nature of unemployment, again, for the last at least 20 or 30 years, right? So we have about, at the moment, as it stands, about 12 million by the broad definition, jobs or unemployed people in the country, representing roughly about a quarter of the population of people who are of working age. So we have a variety of cash transfers targeted primarily to those at the ends of the age distribution. That's children, the elderly, and throughout the age distribution, those with disabilities. But prior to this transfer, there was no transfer which explicitly targeted those of working age, right? And that's for the usual reason around the world, right? People of working age are presumed to be able to support themselves through the labor market. But in the context of structural unemployment, it's almost impossible to do so in that case. So the SRD grant introduced in response to the pandemic at least partially addressed this gap. At the time, it was equivalent to 350 South African rands. It's since been increased by about 5% to 370 rand per person per month. That's equivalent, adjusting for cost of living differences across countries, just under $50 or 37 euros per person per month. Within the context of the wage distribution, that's about 6 or 7% of the median monthly wage in the country. So again, it's a very small transfer relative to what job seekers could earn should they be able to get a job, right? So that should already tell you give you some sort of idea of what potential disincentive effects we might see or might not see. It's explicitly targeted to adults who are unemployed and who don't have any other form of state support, so that includes unemployment insurance benefits and receipt of most other unconditional cash transfers in the country's system. It was initially rolled out in April 2020 for 6 months and has experienced several extensions since. Again, it remains in place today, but its future remains uncertain. Specifically, it remains uncertain whether the transfer will be permanently integrated into the system or not, either in its current design or in an alternative design. Conversations within various academic and policy circles are ongoing. Importantly, the transfer managed to bring millions of largely previously unreached, very vulnerable adults into the system in a relatively quick amount of time. Just to show you this figure right here. Without going into too much detail, the red bars indicate this transfer that we're focusing on here. So prior to the pandemic, we had about 17, 18 million cash transfers distributed monthly. And as this transfer was introduced, by the end of its first 6 months, it managed to bring in about 6 million unique new individuals into the system. And following a brief period of termination and then its reintroduction, as well as an expansion in eligibility, which I'll chat about later, it has managed to bring in about 10 million people. So that's providing cash support to 10 million largely previously unreached people every single month. Just want to mention here quickly that this transfer relative to pre-existing ones in the country is distinct for at least 2 reasons. Thanks, Rachel. Is that 5 minutes left or 5 minutes? Wow. Okay, let's get going. I'm going to have to skip over that and jump into the data and identification then. So we use nationally representative household survey data. That's the labour force survey data from the country. It's South Africa's official source of labour market statistics. Again, we estimate effects of both receipt and loss using 4 survey waves for each. These surveys are, of course, at the quarterly frequency, and given that this transfer is distributed monthly, of course, an individual can receive it in more than once in a given quarter, but we only observe them once, of course, so that's a data limitation that we have. For receipt, we examine effects of the transfer's reintroduction, right? So in 2021, there was a brief 3-month period where the transfer was temporarily terminated, and following a wave of new COVID-19 infections and social unrest, the transfer was reintroduced and importantly was expanded to include a lot more women who were previously excluded. For loss, we similarly take a year's worth of the data and we restrict the sample to prior recipients, and we examine effects on the effects of subsequently losing the transfer following the introduction of a new banking verification system that basically tested the eligibility of individuals based on the transactions in their bank accounts. That introduction resulted in a significant 50% reduction in coverage in the space of just a few months. So from the researcher's perspective, obviously some interesting variation that we have there, but obviously from the participants' perspective, an awful outcome. We make use of unbalanced panel data where we're able to observe the same person for a maximum of 4 quarters or up to a year. How we identify recipients in the data follows a method in our previous work, given that there is no item in the questionnaire which directly asks recipients about receipt of this grant, which I'm happy to chat about later. And again, essentially our approach, going to the last point there, we restrict our sample to eligible unemployed adults. And what we're essentially going to do is apply a staggered difference in difference design and compare the outcomes of recipients versus non-recipients in a staggered setting, eligible recipients and non-recipients. And then for loss, we're going to compare the outcomes of eligible recipients who continued to receive the transfer versus those who were eligible and previously received the grant but subsequently lost it over time. Right? Going to have to skip over this for brevity. Again, our treatment in this case in terms of receipt and loss is staggered in nature, so we have individuals in the data who never, for instance, in the case of receipt, they never receive the transfer. We have those who don't receive it in a given period but receive it later, and those who receive it, for instance, and then don't receive it again, right? So we know, those who are familiar with the explosion of the difference in difference literature, that use of the canonical design results in significant bias in conventional estimates, right? When applying a canonical design in a staggered setting like this. So we make use of Callaway and Santana's semi-parametric estimator, which at its core is a difference in difference estimator. We're still estimating effects by comparing the outcomes of recipients and non-recipients in the case of receipt from before to after receipts of the transfer, accounting for variation in treatment timing, so to speak. For brevity, I'm going to have to skip over the details, but this estimator has a lot of very attractive features that make it very ideal for this type of study. For the outcomes, we focus on 3 in particular: probabilities of engaging in any type of job search, of reporting trying to start a business and then actually gaining employment. To skip over this for brevity and jump into the results. So we find positive average effects of SRD grant receipt in the top panel here. You see, looking at the unconditional estimates, we get a positive effect of 3.4 percentage points on the probability of job search, smaller 1.5 percentage points on trying to start a business, and then a 2.2 percentage point effect on the probability of ever gaining employment. Comparatively, for loss in the bottom panel, you can see that the effects of loss largely mirror those effects of receipt as expected, right? But they are marginally larger in magnitude. So we get an effect of -7 percentage points in the case of job search, no effect on trying to start a business, and after addressing a pre-trend in the employment effects, we get a negative effect of about 2.9 percentage points on employment. In terms of effect dynamics, these show the aggregated event study estimates from Callaway and Santana's estimator. In terms of receipt, we don't really observe much variation at all. Thank you. In terms of loss, however, we see in the case of job search, we see an effect that tends to grow with time, right? We don't see much variation with respect to trying to start a business. In general, throughout our results, it seems like trying to start a business is very unresponsive or very insensitive to either receipt or loss of this transfer. With respect to employment, ignoring this pre-trend here, which is estimated using a minority of treated individuals in the data, which is important to emphasize, we tend to observe this positive short-term effect that fades over time, which is very consistent with our prior work from the pandemic period, right? Which gives us some sort of sense of how generalizable those results were. In the case of loss, however, we see, like the job search results, we see an effect that is negative initially and then continues to grow over time. Just to wrap up, when looking at spillover effects within the household on non-recipient co-resident household members, excluding from the sample single-person households, because of course co-residency doesn't make any sense in that case. In contrast to the direct effects on recipients, we find a negative effect of living in the same household as a recipient of this transfer on job search here of about 8 percentage points. No effects on trying to start a business or employment. And then mirroring these negative job search effects, we find a positive effect of losing the transfer, of living in a household which subsequently lost the transfer but previously received it on job search. One way of interpreting this is that receipt of the transfer relaxes the household's budget constraints and reduces the financial pressure on the household to engage in search that is typically very unproductive and has low returns in nature, right, in the context of South Africa. Given the time constraint, I'm going to have to wrap up and skip over some mechanisms, but I'm going to touch on those in the conclusion and happy to chat about those in detail later. So, we find that these direct effects that we estimate, these average positive effects, are consistent with most studies in the literature. That is, we don't find much meaningful evidence of negative labor supply effects on recipients as predicted by the theoretical model. We see that these tend to be explained by both extensive and intensive margin adjustments, by shifting individuals into participation, and among those already participating, increasing the efficiency of their participation. And it's consistent with prior work, which indicates some sense of generalizability. Some new evidence that we present on intra-household effects illustrates that even for a transfer of a very small size, right, 6 or 7% of the median wage, these effects extend beyond recipients themselves and need not be identical to the effects on recipients themselves, which is consistent with prior evidence in the literature. We argue that there are various policy implications for these types of transfers then in the case of South Africa, but also more broadly in high unemployment, lower middle and income countries. All right, thank you very much. Appreciate your time.